treatments. How safe are they? Having an offspring is seen as the natural way of life, and people are willing to go to any lengths to have their own. However, when they can't naturally, they turn to assisted reproductive technology, or ART. Experts say that the fertility business is worth a whopping 13,033 crores. This has led to fertility clinics mushrooming in all parts of the country. And most of them don't even seem to care about flouting the ICMR's rules, regulations, and protocols for ART. Let's try and understand what some of these infertility treatments, if opted for without proper advice, can do to your health. But first, you need to know what infertility actually means. The medical definition of infertility is the failure to conceive following 12 months of unprotected intercourse. Infertility treatments look to undo this. If you've been classified as infertile, do discuss all treatment options at length with your doctor. You need to know how they work and what their side effects would be. We'll talk about some of these today. The first group of drugs acts by suppressing the natural menstrual cycle. Medicines like Leucrin, Cynaral, etc. They can have side effects similar to menopause. You could experience hot flashes and mood swings. The second option is a hormone that's called gonadotropin that stimulates the ovaries to produce more eggs. Side effects may include weariness, mood swings, nausea, and headache. Since the ovaries swell up, some patients complain of additional pelvic pressure. In rare cases, the ovary may rotate and twist, leading to bleeding and require surgery. These conditions usually continue for the second half of the cycle and may last up to 3 months if pregnancy is successful. The third option is the human chorionic gonadotropin, or HCG, which facilitates the final maturing of the oocyte. Oocyte is a cell that goes on to become the ovum or the egg. It is more uncomfortable than other injections and is often called the trigger injection. Another drug which is used is clomipene, which looks to stimulate the pituitary to produce extra oocytes. Here too, the side effects include headaches, weariness, occasional visual disturbance, and hot flushes. Lastly, some drugs like doxycycline and progesterone don't actually help produce oocytes, but help in other ways by protecting the embryo or thickening the uterine walls. Side effects of doxycycline include nausea, vomiting, diarrhea, skin rashes, and photosensitivity, whereas progesterone can cause perineal pain, headaches, nausea, and drowsiness. Apart from all the side effects we discussed, you also need to know about what is called the ovarian hyperstimulation syndrome. This is a problem which occurs in about 1 to 2% of patients who undergo superovulation induction with the help of drugs. Essentially, fluid from the bloodstream leaks into the abdominal cavity, causing it to swell. Several symptoms include respiratory issues, kidney failure, and arterial and venous thrombosis. Rarely, cases could see a lack of blood supply to the brain and other vital organs. Patients who suffer severe OHSS must be hospitalized and treated. This treatment would involve the infusion of intravenous fluids, and the fluid in the abdomen may need draining off. Summing it all up, the ICMR guidelines dictate that it's the doctor's duty to tell the patients about all the side effects of the treatments. It's imperative to know them before going for any procedure. Women who suffer from health issues, particularly cardiovascular or blood pressure issues, have to be even more careful. Having children may seem like the most important thing in the world, but conceiving shouldn't be at the cost of your partner's, wife's, or even an unknown surrogate's health and well-being. For more such information related to your health, log on to health.india.com.